Welcome to another episode of Voices in Health and Wellness, where we speak with leaders, clinicians and change makers who are reshaping what healthcare looks like today. I'm your host, Dr. Andrew Greenland, and today's guest is Dr. Jeffrey Sherer, founder of the Dental Design Studio, a group of 23 dental practices serving communities across the UK. Jeffrey is not only a seasoned clinician and operator, he's also a former director of the Hillingdon Local Dental Committee, contributor to the BDJ and dentistry.co.uk, and a recognised voice in the media, having appeared on BBC Radio and ITV News. So with that, Jeffrey, welcome to the show and thank you very much for coming on.
Thanks so much. Thanks for having me. And can I just say, I really admire what you're doing, and it's a pleasure to be speaking with you today.
Thank you, and likewise. So maybe we could start with your journey. What inspired you to build a network of practices like the Dental Design Studio?
Sure. So I was always passionate about dentistry, and it was something that I always found I didn't want to work for somebody else. I always wanted to be my own person and run dental practices the way I saw would be best. And I started off quite early on in my career owning a dental practice. And really, I spent the first sort of 5 years of that developing the Dental Design Studio and our brand and learning not just about things clinically, but also how to run a practice and put patients first. And that's something that was really something that I love to do. And it meant a lot to me having my own practice. And then after some time, I thought, well, actually, I've done this successfully with one practice, which was a sort of it was a brand new setup. It was what we call a squat practice. Basically, there wasn't any patients or infrastructure there. And I thought, well, I could see myself doing this again with more practices. And gradually over the years, through sort of acquisitions and winning some competitive procurements, it grew from there. But it was always my sort of dream to have my own dental practice, because I really just wanted to do things my own way and have my own sort of unique slant on providing dentistry.
Fascinating. And with that, what is your secret sauce? What do you do differently that others perhaps don't? And how have you built on that?
Sure. Well, I don't want to sort of knock anybody else down, because there's some amazing dental groups that are out there, and I'm a fan of them, and I know a lot of the owners of those groups personally. I think that from our perspective, we work really hard. We try really hard. We do things not just to try and make a difference in our practice, but also at a national level. So, for example, I spend a lot of my time working with the local dental committee, which is for lots of benefit of lots of dental practices, and numerous meetings that I've had with MPs, especially in the last couple of years, to explain where I feel changes could be brought into dentistry. And in terms of our own practices, we've done a lot of investment in digital dentistry, which has allowed us to be able to offer treatment to patients without the need for dental impressions, which is the sort of more sort of old-fashioned way, if you like, and move to a format that allows us to have a much better environmental impact, and also to give a better result to patients as well. And I think what's nice about our group as well is that we're not backed by any kind of private equity company. There's no external shareholders. So, and I myself am a dentist. So when I make decisions for the group, I make it as a dentist, and I make it with patient focused in mind. And I feel that I'm very accessible as well, so that all the clinicians in our group know me. Everyone has my phone number, my WhatsApp. And when people need help or support, they've got a problem, they feel that they have access to that. So I think those are some of the things that have made us a little different and successful in dentistry, and just constant striving. Myself and my team, we work tirelessly every day, trying to make it better. We never ever sit back on our laurels and think how wonderful we are or what we've achieved. We're always trying to make improvements and do things for the betterment of our staff, our patients, and our practices, and the country's dental care as a whole.
I really do like that ethos that you have about constant care and improvement. What have you learned as your role has shifted from being a hands-on clinician to overseeing 23 locations? What are your biggest kind of learnings and takeaways from doing that kind of scale?
Sure. Certainly it's a completely different skill set. I mean, when you're a doctor or a dentist, you're very focused on the individual treatments that you're doing for your patients. What I've learned is so many other things in terms of like HR, about building regulations, care quality commission, a lot of things about generally running a business as well. I mean, I don't come from a finance background. I didn't know what EBITDA meant. I didn't know much about sort of the recruitment from overseas and visa sponsorship. So I think for me, the biggest thing is it's just been constant learning and having to become, if you like, a mini expert at a lot of subjects and topics, which traditionally you wouldn't consider or expect as a dentist. I mean, finding out about how to take someone who's living in a different country and provide them with a visa sponsorship so they can come and work as a dentist in the UK is something that is not taught to us at university like that. Producing a balance sheet for a bank because we want to borrow some money to buy another practice is not something we learn at university. So I think the biggest challenge really for me is just sort of upskilling myself and learning a lot of business skills and general sort of compliance things that are very different to the sort of clinical work that I studied at university for.
Yes, they don't teach you anything like this at a medical school, dental school, and probably a lot of the other healthcare training institutions. You kind of have to learn it on the job, I guess. So what does a typical day look like for you at the moment? And I dare say there is no such thing as a typical day, but with all of these hats that you wear, how do you kind of structure your time?
Sure. Well, I'm definitely an early starter. I normally get up at between 3:30 or 4 a.m. So my day starts with that, a cup of coffee, and I review all the day's performance from the previous day, catch up with all the sort of urgent tasks that I have. I like to make an early start in the morning so that I feel that I'm on top of everything when the rest of the world wakes up and starts. I like to spend a little bit of time learning about current affairs in the morning and see what's happening in the world, just so I keep abreast of the wider world and don't become too sort of completely narrowly focused on the business of dentistry. A lot of times I'll spend dealing with recruitment, so new individuals joining us, looking at potential acquisitions. As you probably know yourself, Andrew, there's a lot of admin that goes with NHS provision. So I'm constantly filling in data requests for data from patients we've seen, the feedback on pilot schemes that we've taken part in, all the sort of submission of all the transmission of NHS claims for patients that we've treated. So a huge amount of data work. I have a regular meeting most days with my senior leadership team where we address any sort of major issues that are presenting or on the horizon. Meeting with my finance director as well to see how we're doing and any areas of questions about that. And really what I'll try and do is spend some time as well providing coaching or mentoring for some of our clinicians in the group as well. So there's not a day that goes by that I won't spend some time with some of our clinicians, just helping them to improve or answering any queries. And also a big part of what I do, which is probably not the nicest part, is dealing with some of the complaints that we receive as well. And that can sometimes be quite time consuming because obviously I have to investigate it and then provide a response as well. And the more practices you have, the more people you see, the more clinicians you have working as part of your group, unfortunately, the more complaints that arise really like that. And I think in the sort of post-COVID era that we're in now, people are a little less sort of kind to each other at times, and people are quite quick to voice their unhappiness or disapproval with something as it happens.
Thank you. Obviously, a lot of what you've mentioned is sort of quite managerial, operational, business related, but how do you sort of stay connected to patient care and community needs whilst you're managing 23 practices?
Sure. So I still do some clinical work myself as well. So I haven't completely sort of stepped away from the cold face. I go in regularly to the dental practices and see some of my long-standing patients. I also provide cover as well for when some of our dentists are away in certain practices. I'll travel to the practice and cover all the emergencies that are there. And I really like to do that because I think dentistry is very close to me. I spent a really long time studying it, and it's a shame to sort of allow myself to completely de-skill. And also by visiting the practices and seeing the patients, it also helps me to see the quality control that's happening in the practice, speak to all the team, have a look at how well the equipment's being maintained. And I still feel that I've got a lot to offer clinically as well, because I graduated 25 years ago. So in that time, I've built up a lot of experience clinically, and that's for the benefit of the patients. And actually, what's quite a funny thing is sometimes I sometimes cover 111 sessions, basically where we see emergency patients that don't have a dentist that have been referred to us, and they come in and see me, and I've never seen them, they've never seen me, and I'm treating them, and it's like the sort of owner and founder of the whole group is providing them treatment at that appointment, and they have no clue who I am. And I'm not trying to make it out that I'm some big shot. I definitely don't feel like that or consider myself like that. But it's like you wouldn't, in most businesses, you wouldn't get like the sort of founder, chief executive sort of dealing with it. You know, you wouldn't get Jeff Bezos packaging up your Amazon order in the warehouse and sending it there. So it's quite a nice feeling, really, like that, because it just sort of shows that you're never too big to do the job, and also hopefully those patients that I do see get good quality care from me as well.
So you're kind of working undercover when you do that work.
So it's like undercover boss, really.
Exactly. You mentioned earlier on that you managed to grow and scale without having to use private equity money, and I know roll-ups and that kind of structure and process is quite rife in dentistry. Do you see any pitfalls with that kind of scaling with private equity and that kind of model?
I think what happens is you do lose quite a lot of control with that. I mean, look, it's no secret we have been approached by private equity companies before, looking to sort of develop a buy and build. I think for me, what it is I like to do things my way, and at the moment, I have a lot of freedom in decision making in terms of buying practices, not buying practices, investing in the practices that we have. And I suppose when you move into that model of having a private equity partner, you do have to have a completely different shift in mindset, because it's no longer totally your business. You have got these strategic partners, and you have to take on board their sort of wishes and desires, and the fact that their main focus is to try and make a return on the money that they invest. So for them, they're totally data driven, they're totally finance driven, because ultimately that's what they do. Sometimes in dentistry, and sometimes in my group, and I'm sure in a lot of other dental groups as well, we do things and we make decisions that are not always the most financially right decisions, but they're right for our patients, or they're right for our practices, because at the end of the day, I see it as a bigger thing than just sort of pounds and pence like that there. So I might go and buy a piece of equipment that won't necessarily make us any money, but it makes the patient have a more comfortable experience, and it makes life easier for the clinician. So financially, it might not be a good move in pounds and pence sort of perspective, but it's the right thing to do in that practice, in that situation, in that scenario there. And I love having that freedom of being able to do that, and not having to sort of justify things to an external group like that there. But I do realize it is difficult if you are a private company, because dental practices are expensive to buy. You can easily be looking at paying north of £1 million to buy a practice, and a lot of people just don't have those resources, and they need that in order to continue their journey like that there.
Thank you. So moving on, on a previous chat, you shared a story of your hypertension screening pilots that ended up engaging hundreds of patients. Can you walk us through how that started and what the outcomes have been so far?
That was a really lovely thing, and it's something I'm extremely proud of, that we were part of that there. So basically, we were approached by the ICB, the Integrated Care Board, for two areas in Lincolnshire and Yorkshire and Humber, about taking part in a hypertension pilot, which would basically involve us taking blood pressures for patients that attended the practice. And the idea of it was to identify people who were suffering from hypertension, but it was undiagnosed. And so it was a massive sort of public health exercise, really, to see whether we could identify patients who maybe don't visit their GP regularly at all, but come to the dentist much more regularly. So we started that program. We ran it for 6 months in about 6 of our practices. Over that time, we took the blood pressure of many hundreds of patients, and a proportion of those patients, probably in the region of about 2 or 3% of those patients, we identified that they had significantly raised blood pressure, and those patients were then either put on a 7-day blood pressure program, or referred to their GP for further investigation. So we didn't make the diagnosis ourselves, but we signposted the patients to their GP. And what it really demonstrated how holistic work can take place in dental practice, and how in healthcare settings you can do so much more than just filling teeth or doing dentures or so like that. So it was really a great thing to be part of. There was some challenges with it, because initially patients were quite sort of a bit sort of wondering, well, why are we doing this? Are they allowed to have it with us when they haven't checked with their GP? Was there were we going to charge them for it? It was completely free of charge for them. So there was a little bit of educational work to do in terms of getting patients on board. But it was also lovely for our team as well, because a lot of the blood pressure readings were taken by dental nurses, and that was something that was a great upskilling for them. They learned a lot from it, and it really made us feel like we were helping people more than just with dentistry, but helping the whole person rather than just the mouth. And as you know, there's lots of links between gum disease and cardiovascular health. And so it was really, really great to be able to offer that program.
I mean, why do you think dental practices are a good point of entry for broader health screening?
Sure. I mean, it's funny with hypertension, because a lot of people are quite nervous when they go to the dentist. So there was probably some readings that were elevated that maybe wouldn't have been elevated in different settings. But I mean, we do see a really large amount of the population on a regular basis. I mean, to put it in some numbers, since we opened the Dental Design Studio 20 years ago, we've treated over 1 million patients. So that's a huge population of people that are coming through the practice regularly, who maybe don't see the GP, or they maybe feel fine. So it is a great opportunity within dental practices to provide screening for other healthcare matters in an environment that is a hygienic medical premises, a premises that has to maintain good levels of cross-infection control, that's registered with the Care Quality Commission. So it's a great healthcare setting, but it's a setting where patients come regularly. So we have the wonderful opportunity to do so much more for people.
Brilliant. I think you also mentioned a growing focus on diet and obesity, especially in ethnic groups and children. How are you bringing those conversations into the dental setting?
Yeah, so it's obviously that's never an easy conversation to have with patients like that. You do have to be a bit tactful when you speak to people about weight and obesity, especially in a dental practice setting, because the last thing we want to do is upset or offend anybody there. But because of the fact that diet is such a big factor in tooth decay, it does naturally lend itself to being able to have discussions about diet and obesity with patients. And more recently, we have been taking part in some programs which have allowed us to sort of learn more about the effects of obesity and dental health. And we've been training some of our team to have those conversations with patients who are sort of showing signs of or are obese, especially children who, by being obese at a very early age, can lead to a lot of comorbidities later in life. So again, it's another sort of area that dental practices can have a really big role in helping to prevent disease. And these are things that further down the line have a massive cost implication to the NHS and healthcare delivery. So by having these early interventions that we can provide do go a long way to help preventing disease.
So thinking about your whole operation, 23 practices, what's working particularly well for you in the model right now? What are you most proud of?
One of the things that I find that gives me a lot of pleasure is seeing the development of individuals. So we have taken on a lot of apprentices who have sometimes been school leavers, people from other careers, and they've joined us as apprentice dental nurses, and through working with us and the apprenticeship program have gained their qualification. I love to see people get their qualifications because I know it's something that they then have for the rest of their life, and you can't sort of take it away from them. So that's something that makes me really proud. The other thing that one of my really proud moments is just, and this probably sounds a bit sort of egotistical, but I honestly don't mean it like that. But the Dental Design Studio, which is something that I came up with in my head sort of 25 years ago, this year we were mentioned positively in the House of Commons 3 times by 3 different MPs who came to visit our practices there, and to sort of see yourself that you started something from scratch and you put so much time and energy to see it being sort of talked about positively by MPs in the House of Commons is something for me that makes me feel like that what we have done has made a lot of difference to society and to our patients there. So these are things, and obviously the growth of the group as well. For me, it's not about sort of finances. I mean, obviously everyone needs money to live, and that's of course a factor, but I just like to see things grow, and I like to see us having more practices. And every time we take on another practice, it's like having another child. And so I'm extremely proud of all of them, and some of them at certain times act well and are very good, and sometimes some of them act badly and are very bad, but I love them all, and I'm extremely proud of what we've achieved in dentistry. And I feel that the job's not done. There's a long way to go, and there's a lot more that can be achieved as well.
Well, congratulations on your parliamentary recognition. On the other side of the coin, what's perhaps more frustrating thing to have to deal with, or complexities, or are there any particular challenges that you're having to work through at the moment in what you do?
Sure, yeah. So certainly recruitment in dentistry can be quite challenging, especially for practices that are in more rural areas. A lot of the young dentists now who are qualifying want to work in big cities because of the lifestyle that it gives, as opposed to sort of more rural, quieter locations. So encouraging people to work at those places can be challenging. I think also in dentistry, the younger generation, and when I say that, it always makes me sound extremely old, but the younger generation of dentists are more focused on, or want to be more focused on, provision of private dentistry as opposed to NHS dentistry. So it can be difficult. I mean, we offer NHS dentistry in almost all of our practices, and more dentists are not wanting to work within the NHS dental system and work privately. So that is a challenge in itself. And sometimes the government does things that are really challenging, that make our job harder as well. So one of the things, for example, was Brexit. So that happening made life difficult for us because of the fact that suddenly dentists from Europe, and there was a lot of dentists from Greece and Spain and Portugal that were coming over to the UK regularly to work as dentists, had to go through a visa sponsorship system, which added a lot of extra cost and complexity. Obviously during COVID, that was an extremely challenging time for dental practices because we couldn't see patients as much as we wanted to. And there was a lot of sort of protocols that we had to follow to ensure that, that people weren't getting infected, both staff and patients. So there has certainly been some challenges. You know, I won't say it's all brilliant all of the time. There's some days that I go through the day and I feel like I've been in a really tough boxing match. You know, you get beaten up a bit because things go wrong and you sort of put your head in your hands. But then the next day something really good happens and you think, well, that's made it all worth it, like that. There, you know, if you might have a day where the computer system's not working properly and one of our good dentists resigns and you think, wow, I'm really under the cosh here. And then the next day we get somebody applying to join one of our practices who's a really good dentist, and we're very thankful to have them. And then that makes us feel really happy. Or the NHS come to us and say, would you be happy to take on an extra 1,000 checkups per year? And you know, that makes a big difference for that particular practice and those patients. So there's highs and lows as with anything, but we always approach it in the same way, which is we try our hardest and we have a smile on our face. And certainly I'm absolutely thankful for every day. And I absolutely love the fact that we're doing what we're doing. And what I always say to my team and anyone who I speak to is that one of the brilliant things about dentistry is that we're helping people and we're making a living as well. And I think that's a really great thing because we're doing something positive and we're earning a living from doing that. There's a lot of jobs that people do that don't really make a positive difference to society. Okay, it might provide them an income and pays the bills, but it's not really for the public good. So to do something that is for the public good and helps you to support yourself and your family is an absolute blessing and a privilege.
Thank you. And if you had a magic wand and you could fix one thing in your business tomorrow, what would that be?
I'd certainly would remove some of the red tape and some of the regulations that we have. I know that some of these things are there designed as sort of safeguarding and help and supposedly to make things better. But there are things in dentistry that do hinder us, certainly. For just as a very brief example, when we have dentists who qualify from overseas that join us, they have to have a period of mentorship before they're allowed to work sort of fully licensed, if you like. And that can be challenging because these are dentists that can work privately without any restrictions. But in order to work under the NHS, they have to have a mentor in the workplace. And sometimes that can be difficult in practices where there isn't an available mentor. So why is it that they can work privately without any restrictions, but in order to deliver NHS dentistry, they have to have all of these conditions on them? There's also a huge wait for people wanting to pass the overseas registration exam. So these are dentists from other countries outside of the EU who are qualified dentists, very experienced in their country, who want to pass the exam to enable them to work as dentists in the UK. And it's a complete lottery when it comes to spaces being offered for that exam. They only have a limited number of seats per year. Thousands of people apply for it, and only a handful of people get selected. And that's very frustrating for those individuals who could be working in NHS dentistry in the UK and solving some of the access problems that we have, but they just can't get a place to sit the exam to prove that they can work here.
Obviously, your business, you're always looking for new referrals, new patients. But if you had a sudden influx of new patients next week, what would happen to any given practice? Would anything break, or how would it kind of mop up a surge in demand?
Yeah, that is a good question. And sometimes we do have those sort of situations where we're suddenly offered a lot more activity. So we might get told that we can do an extra 10% this year on our activity, what we would normally be commissioned to do. And that can be difficult because most dental practices will have a limited number of surgeries available, a limited number of clinicians. So if that happened on a big scale, it would be difficult. But in our practices, we do have room for that, either by opening longer into the evening. Not all of our practices are open at weekends. Not every single dental chair is utilized 6-7 days of the week. Some of our practices, we are open 7 days a week from 8 till 8. But yes, I think most practices, if you suddenly said, okay, you've got 50% more patients joining, would initially struggle with that because it takes time to recruit clinicians and make sure you've got not only the surgery availability, but you also need dental nurses and reception team to manage that influx as well. We sometimes see examples of that where new practices open in various places and there's large queues down the road where people are wanting to join that practice and they just don't really have the capacity to absorb all of those patients immediately, but yet the demand is massive. And make no bones about it, there is massive demand. One of our practices where we opened 2 years ago now, we put on the website an opportunity for people to register their interest for joining as an NHS patient. And within 24 hours, we had over 2,000 people that had registered their interest there. So there's a phenomenal demand for dental services, especially in some parts of the country, which I suppose on one hand, as a business owner, is a good thing because you want to have customers. Any business will want to have customers because that's what makes the business successful. But at the same time, it's also very sad to see that there's a lot of people out there who are just absolutely desperate because they just can't access basic dental services because there isn't availability for them.
Thank you. And if you were starting again today, obviously being on quite a journey, would you do anything differently? And is there a risk that you wish you'd taken sooner?
I often think about that myself, and it is quite difficult because the reality is that the lessons I've learned are because of the decisions that I made at various times. So I don't think I would do a lot of things differently, to be fair. I think that what I would probably do is be a little bit kinder to myself in the respect that I do put a lot of pressure on myself to achieve and perform and to make things work as well as possible. And sometimes I probably should have allowed myself to have a holiday or a bit of a break, or not work at weekends, or not work late into the night. So I think I would probably be a bit kinder to myself if I did it again. but at the same time, your journey is what makes you. And I think that I'm very thankful for everything that I've achieved and done. And I hope that we continue doing what we're doing. And certainly I've worked with some incredible people, and I'm very thankful for those relationships that I've had with the people that I've worked with. Some incredibly hardworking people that have helped me. It's certainly not something I've done on my own.
And finally, what are your goals for Dental Design Studio over the next 12 months? What's on the cards for you and the business?
So we've got some acquisitions. We've got some more practices that we are looking to onboard in 2026. So that's certainly something that we're very excited about. In one of our practices, we're relocating to a much bigger premises as well, which I think is going to provide an incredible center for patients. And also, there's some really big changes coming about for NHS dentistry starting in April 2026, which I think will give patients better access to urgent dental care. And so we're excited to be part of that and learn about that and get involved. And I think my biggest sort of goal is to carry on doing the good work that we're doing, make the business bigger with more dental practices, but at the same time, maintaining the standards and the quality and care that we are offering at the moment. The real challenge, obviously, as you get bigger is that you lose some control over the quality of the service that you offer. And I'm really determined that won't be the case.
Jeffrey, this has been such a wide-ranging and thoughtful conversation. I think a lot of people don't expect to hear about hypertension pilots and preventative medicine from a dentist, so this has been really refreshing. Thank you so much for your time. It's been a real pleasure to have you on the show.
Perfect. Thanks so much.